So as we started to think about this whole notion of workforce resilience and vicarious and secondary trauma, immediately one of our good friends came to mind, and that's Dr. Ken Yeager. Dr. Yeager is an associate professor, clinical in the College of Medicine, the Department of Psychiatry, and he's also director of the Stress, Trauma, and Resilience Program at The Ohio State University Wexner Medical Center. He's also the David Schuler Professor of Patient Compassion. He's a practitioner with over 30 years of experience in clinical practice, including working with the National Football League as a treating clinician for the past 15 years. He also has numerous research studies and publication in areas of crisis intervention, treating comorbid substance abuse and mental illness, quality improvement, and evidence-based practice. Among the things that Director Plouck shared with you yesterday is the effort that we've been working with the Ohio Peace Officer Training Academy and the trauma-informed policing curriculum that we helped write, and that all 30,000 law enforcement officers will be participating. I don't know that we could have made that happen without Ken's expert advice, particularly as we developed that curriculum, mostly with the intent of helping law enforcement officers understand that the victims and the suspects and the witnesses that they interact with probably have some trauma behind them, and maybe some of that behavior that law enforcement officers are observing might be because that person is being triggered just by the presence of law enforcement. And so really at the law enforcement and OPATA's suggestion, like, well, we get that trauma happens to the people that we're going to engage in, but what about the trauma happening to us as law enforcement officers? So that curriculum really is two-part, understanding the trauma that they interact with and then the trauma that is occurring for them just in their job as law enforcement officials. And really, we wouldn't have been able to do that without Ken's expert advice and guidance in that. So I want to introduce my very good friend, Dr. Ken Yeager.
Thank you. I'll start like everybody else does. Good morning. It's kind of mandatory, isn't it? How is everybody today? Good. I want to start with a little bit of a story, and I'm going to drive the sound folks nuts because I don't know how to stand still. And I'm going to wander around, and it'll probably cause feedback, and for that I apologize. I also want to thank Kim and Dr. Hurst and Director Plouck and the training committee for this invitation to speak here today, because this is something that has become a life's passion. And as we all go through our careers, we begin to look for things that we can be passionate about in our work, because it's really what drives the energy. And sometimes something finds us in our work, and this is the case of dealing with secondary trauma, trauma-informed care, and the entire process that we're going to talk about, and you have been talking about. Several years ago, I was walking through the emergency department doing a gap analysis for a program that we were developing for family members who have been traumatized. And in the back part of the old emergency department at Ohio State, there were 3 traumas that came in almost right on top of one another simultaneously. And I'm walking through the back hallway with a trauma surgeon and an ED physician. And the conversation went, you do a wonderful job of putting the bodies back together, but who puts the patients back together? And there was a pause. And he said, well, nobody. And there was another pause. And the ED physician looked at me and said, but Ken, who puts us back together? And he turned away And as he turned back, I could see a tear kind of going down the cheek. He said, I don't know that I can tell another parent that their 16-year-old isn't going to survive. Who puts us back together? And the STAR program was born, and our focus was on helping those who help. Because there are challenges out there. And, you know, in academic medicine, we have to cite everything. And this is a stack. If any of you want, jaeger.5@osu.edu is my email. I have bibliography on top of bibliography on top of bibliography of evidence-based approaches to traumatization and how you manage it. So let me just pose a question to you. And I'm going to apologize up front. Because I work in a hospital, I'm going to use the term patient a lot, and I understand it's patient, it's client, it's consumer, it's person, it's individual, it's human being. Maybe I should just go with human beings, because that's kind of the common denominator here. Although I am really, really, really liking pet therapy of late, so we have to worry about the pets too, right? So just amongst your peers and yourself, think about what is the single greatest threat to quality care and satisfaction for the people we serve. So just talk amongst yourselves, and I'm going to drive people nuts and grab a microphone and come down and we'll hear from you. So what's the single greatest threat to quality care and consumer, patient, individual, human satisfaction? Okay, so we don't go too long. Who's got a good answer for me? Who has a really good answer? Somebody throw a hand up so I can see you here. Okay, I'm coming at you. This'll work. Biggest threat right here.
We think it's respect.
Respect for staff, for patients?
For everybody.
Overall regard for everybody.
Everybody.
Beautiful.
Because respect falls under everything.
Yes.
You have to have respect to respect them, to do the care. Because, like for instance, if you get personal with them, then personal can fall under the respect, because then they wouldn't give you good care. Like if you were to have a more than a relationship with like say if you're an EMT and an EMT comes to your house to pick you up,
right?
Then if you have a kind of sexual relationship with them, then they would give you special care than they would someone else.
Right. So we have to have boundaries.
Yeah, we have to have boundaries.
Right.
Different care.
And respect.
So it has to be respect, because
good.
It has to be respect for everybody.
Beautiful.
So.
Thank you. Respect. Yeah. Challenge. Here we go.
So we're going to go with compassion fatigue, but right behind it we have business decisions.
Business decisions and compassion fatigue. Love it. Okay. Coming over here.
Kind of a three-pronged answer: lack of communication, education, and advocacy on the part of the patient. And
okay. Education.
on the patient's end. Yeah.
On the patient's end. Okay. Coming over, we're going to stop right here.
Funding and disengaged staff.
Oh, funding and disengaged staff. Oh, are you on the same line?
The bottom line, trying to do more with less. So wearing out the staff and can't do all that we need to do.
So we're all trying to get it done.
And so we're going to throw insurance in there too.
Okay.
It's a good thing, but
sometimes it works against you, doesn't it? Yes. So any other major thoughts here that we just can't live without? So all of these are factors that are getting in the way, and all of these factors contribute to vicarious trauma, compassion fatigue, and burnout. And there's growing literature on the numbers of staff that are experiencing burnout. The numbers are becoming frightening. For folks working in healthcare, social workers, nurses, physicians, the amount of depression is twice that of the general population. The amount of anxiety is twice that of the general population. And you've been hearing about trauma for the last day and trauma-informed care, and you start thinking about how trauma works on the brain and how that heightened amount of awareness, of vigilance, impacts the individual, takes up their brain's bandwidth so that they can't think, they get stuck. If you can't have the gas to take care of anybody else, it gets in the way of quality care. So when we're talking about vicarious trauma, we're talking about the psychological cost of caring for those who have been victimized, while at the same time feeling a sense of responsibility to help. It's a concept designed to provide a framework for us to understand the negative effects of exposure to trauma that others have experienced and how their trauma, in turn, impacts us moving forward. And it is a process of change, leading to changes in our worldviews, our values, our beliefs, our trust levels, our tolerance, and our need for control. Just with a quick show of hands, how many of you have heard stories through your work that have changed the way you think about the world? Yeah, take a look around the room. Look at the number of hands out here. Thank you. We are raised to believe in a just world belief, right? We are raised to believe that if we work hard, if we do things right, good things will happen for us. Good things will happen to the people that we're helping. But yet, every day, we see and hear things that challenge that belief, that get in the way of the defense structures that enable us to continue to work, and in turn, and subtly, impact the way that we interact with our families. I didn't realize this until I started doing this work, but it certainly has had an impact on how I raised my children and what I say to my kids about safety and what I thought about when my kids went away to the university, because I know what I did at the university. That is the biggest frightening factor of all as a parent. It's like, oh my gosh, I'm sending them there to do what I did. The effects are very real. They are potentially permanent, and they are cumulative. The fact of the matter is that this can emerge at any time in your career. I have worked with healthcare workers who are the strongest, most powerful individuals I've ever met, but yet that one case came in that tipped them over the edge. And they don't know what tipped them. Results in impacts that last long after the interactions of the cases that created the trauma. How many of you have a case that you carry with you to this day that may have happened a very long time ago? And how many of you have multiple cases that you carry with you? Yep. We tend not to think too much about this, but these are the cases that created our traumas. So how does this happen? Where does it come from? What's the process? So what I'd like to do is try to build a model, but I'd like to begin with you. So I'm going to grab the microphone, and I'm going to go down, and so there's a rule to this game. Don't everybody talk at once, because it kind of goofs up the group process. But let me ask a question. Why did you come into the helping profession? Why did you start this level of work? And I'm just going to pick on people. Why?
Because I wanted to help people.
Because you wanted to help people. Why did you come into helping? No?
I want to say the same exact thing.
That's okay.
Yeah, to
You
help
wanted
people.
to help. Why?
I thought I could teach what I thought I knew.
Yeah, absolutely. Why did you come into the helping field?
I think it chose me.
Ah, yeah.
Every experience I had just kept taking me to the same place in college, and it was like, oh, I guess this is where I'm meant to be.
This is where I'm supposed to be. And you kept taking tests and passing tests.
And enjoying it.
And enjoying it and having that sense of accomplishment. Mm-hmm. Excellent. Why this line of work?
Wanted to be of service to others.
Wanted to be of service to others. Yeah, why this line of work?
I wanted to make a difference.
You want to make a difference. Yes. Why this line of work?
I wanted to help other people not experience what I experienced.
Breaking the chain. Yes.
Well, if you do something that you love, it's no longer work.
Absolutely.
I wanted to treat people with care, compassion, and kindness that I didn't receive.
So the powerful tools, the powerful thoughts, the powerful things that bring us to healthcare, to the work that we do. We see this all around. There's the desire to help, sense of accomplishment. It's interesting, they don't let us work with people right away, do they? They kind of want to check you out. How do you do this, right? So they give you a little bit of time to check things out. Wanted to contribute to the well-being of others and to make it different than maybe your experience. And these are the things that bring us to work with others. These are the things that drive us. These are the things that are so important to us that help us to make the difference. Now, nobody said you came here because of the cushy banker's hours, right? Nobody. How many of you came here for the six-figure salary? Yeah, probably not. Probably not. And when you were coming into the field, did they clearly, those who were instructing you, did they tell you about the expectations? Maybe not. And did they tell you that the expectations would become greater every year that you practiced? And did they give you a hint about the demands, the documentation, the demands of hours, the demands of technology? Has your job become more and more complex as time goes on? And have you wondered why it becomes more challenging as time goes on? There are lots of inputs. See if we hit this right. Are the patients seemingly more challenging and sicker? Yes. Are the family's expectations maybe at times unrealistic? Very high? Is the work becoming more and more complex? And you're spending more time documenting, you're spending more time getting permission to do the work that you want to do? How about your work environment? Do you have the time to have the collegial interactions with your peers that you want? Or do you find yourself racing through the day to get your tasks done? How many of you take breaks? Okay. How many of you eat lunch at your desks? Oh, there go the hands again. How many of you realize that you started to go to the bathroom at 9 a.m. and it's now 10:20 and you haven't gotten there yet? We laugh, but it's not funny. Your bladder is not laughing at you. It's the expectations, it's demands, it's the inputs that lead to the other side of this. And not going to the bathroom could lead to physical distress, but that's not the only form of physical distress. Have you had the situations where it leads you to question your ability? Have you had the situation that's led you to ask yourself, what am I doing here? Have you ever considered leaving the profession? Have you ever thought, I am just going to shave my head and sell flowers at the airport? There's a hand. Dude, you're halfway there. Prochaska and Di Clemente would call that contemplation, you know. Stages of change. What is the output of this on our healthcare professions? Stress, anxiety, heightened level, twice that of non-healthcare professionals. Depression. I'm not going to say absenteeism because I don't think it is absenteeism. I agree that we need to take time to take care of ourselves, but I don't think we do. I think it's presenteeism. How many of you in the last 6 months have drugged yourself to work dead? Come on, be honest with me. And the reason why, I'm guessing, is you don't want to leave your peers in a lurch. Because if you're not there, who's covering for you? Any of you carry a pager or electronic device that work can call you? So it's really the electronic leash of this century, right? We all have one. How many of you have found yourself having a startle response when your pager goes off or your text goes off? Yeah? How many of you now struggle with chronic illnesses? Yeah, the young people in the room are saying, nah, not so much. The folks that have wisdom here, yeah, well, it is what it is. What are the culprits? Vicarious trauma. We see things and hear things that we shouldn't hear. As a result of that, traumatic stress, moral distress. Why are we doing this? Is this really making a difference? And compassion fatigue. I had a nurse about a year ago now call me, and most people just call me Jaeger. My phone rings, said, Jaeger, yeah, I'm in trouble. Why are you in trouble? She said, look, I'm up here in the ICU. I have an end-of-life case, and I'm looking at my watch thinking, man, what's taken so long? I'm in trouble. I know I'm in trouble. So the STAR program shows up and we talk. The reason she was hurrying is she did not want to pass that case on to the next nurse. She'd been there the entire shift and she wanted to see it through. But yet it's scary to think about that. Is this an accurate depiction of your world? I mean, it probably changes for everybody depending upon what kind of work you're doing. The nuances of this is different for lots of areas. Today's talk is about interventions that are designed to build resilience and coping. But I think I have to qualify by at least painting the picture of the world that we're living in and the challenges that we are facing in caring for others, because the work we do is complex. There is a discussion of critical thought. And the one thing that I want to point out, at the intersection of the green arrows and the red arrows, the things that bring you to the healthcare field and the things that challenge you in healthcare is one thing, and that is your education, which has taught you to think critically. So when something goes wrong, because you've been taught to think critically, how many of you use statements such as, I should have, or if I'd only? What if? Okay, so I would like for you to make a promise for me today, and that promise is, thou shalt not should on thyself. Okay? Please do not should on thyself. That's the first process of making things go better. So, how do we get started? So, let's talk about the evidence and let's talk about the experience. There's a long list of references again, but let's think about what are the signs and symptoms of burnout and compassion fatigue. Let's talk about the personal organizational stressors that lead to that, and let's talk about the link to self-care and compassionate care and how these ties together. So let's talk a little bit more about what are vicarious trauma, what are second traumas, and what are the big T traumas versus the little t traumas. And by that I mean the big T traumas are, in hospitals, they're the huge events. In the community, they're the big events. But you know what? Those aren't the ones that get you. It's the little T traumas. It's more the death by 1,000 paper cuts that sneaks up on you, that weighs on you, that weighs you down. So what does staff say? So staff not immediately involved in a traumatic event have the ability to be traumatized by what they see and hear in their clinical work. So I had a staff person say to me at one time, I knew after speaking with her and hearing what had happened to her that I would have trouble sleeping. I just knew it. I had no idea this case would haunt me. I couldn't get it out of my mind. And when I closed my eyes to sleep, it was right there. And I just kept thinking, what's going to happen to that poor person? You hear things that challenge your just world belief that you can't get away from, that you cannot shake because it makes you worry about how safe the world really is. Not all cases out there involve an immediate trauma situation. Frequently, the case that hits too close to home, when a patient or a client is similar in age to the family member, it shortens that professional distance that we use to keep ourselves away. So when that professional distance is shortened and the respect is lost, gained, and the boundaries become blurred, we have problems. And I clearly remember the health worker saying, I'm looking at this man and he's exactly the same age as my husband. His children are the same age as my children. They go to the same school, and he is so sick. And something inside of me just snapped. Because it puts in mind what your risk might be. There are times what we do is not within our control. And this at times leads to stress and distress. Communication, support, and understanding all play a role in managing stress and traumatic stress, vicarious traumatization, and moral distress. But you know what? Not all the same team members are on the same page. And different team members have different views of the case based on what they know about the case. So the worker in the community might be looking for the physician to increase the medication, but the physician might be looking at the person in the community to link to better supports and to build a better support group. And without having the conversation, it's hard. And the family members are just wondering, why my patient, why my son, why my daughter, why my husband or wife is not getting well. And the person having the conversation may not have all the information. And they keep thinking, why are we doing this? I don't understand it. This isn't going to make any difference. It's just causing pain. I don't understand. We feel helpless at times. And we came into this field to make a difference. So the question becomes, how do we mitigate the impact of second victim syndrome in our colleagues and ourselves? So second victim isn't really anything new. Albert Wu at Johns Hopkins University actually coined the second victim phrase around 2000. And he talked about his PTSD for those of us who work in healthcare with human beings, with other people. Second victims are healthcare providers who are involved in unanticipated adverse patient events, in a medical error or a situation in the community where a patient is injured or suffers a trauma, and the healthcare worker is traumatized by that as well. How far back does this go? I know this is a wall of words for a slide, but let me tell you the story. It goes back as far as 1817, the first recorded case, which is actually a triple tragedy involving Princess Charlotte, the only legitimate grandchild of George III, and a physician by the name of Sir Richard Croft. So the Princess Charlotte's child was to be the heir to the King of England. So an honorable lineage. And after a torturous 2-day, 50-hour labor, Princess Charlotte delivered a 9-pound stillborn son. 5 hours later, Princess Charlotte died from postpartum hemorrhage and shock, likely. Croft is the physician unable to deal with the loss of 2 lives committed suicide in the courtyard, hanging himself in a tree that looked at the room where the princess died. And you think, oh my gosh, suicide? Would somebody commit suicide over this? Would you be surprised to know that there were 400 physician suicides last year? Nursing statistics running close to that, with social work statistics running close to that as well. There is an impact. You see, second victims feel personally responsible for patient outcomes. How many of you feel personally responsible for your patients? How many of you worry about your patients, wake up at night thinking about them? And if the patient's not doing well, how many of you feel as if you failed them? And you start second guessing your clinical skills and your knowledge base, and you worry about the patient and their family, concerned what their peers will think. And if you lose a patient, you worry about what happened to the patient, but then the second thought that makes you even feel more guilty is, will I be sued? Oh my gosh, I feel horrible. I'm worried about that. We may not suffer the mental health or the tragedy in the community, but we're standing right behind them. And while they're hit by a larger wave of trauma, we're still hit by a secondary wave of trauma. And then we go to the next patient and we share their trauma. And we go to the next patient and we share their trauma. And we go to the next patient and we share their trauma. Who are you sharing your trauma with? Where do you offload? We started the BEST program. I couldn't think of a better acronym. BEST sounds really good. It's a STAR program, so we have these little stars with a badge that reads BEST, Brief Emotional Support Teams. And what these brief emotional support teams do is they're peer-trained individuals on all of the floors in the medical center that go around and support people after difficult things happen. Because let me tell you what happens after a traumatic situation. It's the rule of 3s and 5s. It's something you can take out of here today and understand. In the first 3 to 5 hours after a trauma, there's chaos. Everybody's running around trying to figure out what happened. Oh my gosh, what happened? What happened? And there's all kinds of misinformation, and the telephone game starts, and all kinds of crazy things happen. In 3 to 5 days after a critical situation, you are hypervigilant. It's right here. It lives right in front of you. You try to sleep, it's right there. You try to think about something else, and it comes back in. It's an intrusive thought that is with you for the next 3 to 5 days. You're hypervigilant. You're controlling. You're avoidant. You sit down to watch television, and you click through all 3,000 channels, and there's nothing on. But yet you don't remember what you looked at. 3 to 5 weeks, you begin to pull in different knowledge that gives you a new view of the world, maybe a more cautious view of the world. 3 to 5 months, there becomes a new level of functioning. And in 3 to 5 years, you're the administrator, you're the supervisor, helping your staff person who's going through it for the first time. I have seen the rule of 3s and 5s over and over and over again, and have come to the conclusion that we need psychological first aid for our staff. We need to be able to be there. We need to challenge the things that they see, because they see things that they shouldn't. You see things that you should never have to see, and you're forced to do things that you should never have to do. But yet we do it because we love our work. We need to provide consistent support and follow-up and applying evidence-based practices to make this better. Because there is a continuum of trauma. How many of you have stress? Yeah. How many of you have woke up late to go to work? And you might have the stress of not being able to get your coffee? Now that's a bad day. That is a bad day. When you can't get your caffeine, that's a bad day. So a stress turns into a crisis when you pull out of the Starbucks and you're pulling relatively quickly to get into traffic, and your extra large coffee, super caffeinated, maki whatever, falls out of the cup holder in your brand new car and splatters caramel everywhere. Nah, it's a crisis. You ever try to clean that stuff up? It's impossible, it's sticky, it's terrible. Trauma comes about when you're racing to get into traffic, your coffee spills, and you stop looking at the road and you wake up just before you hit another car. Or worse yet, a pedestrian. So all of us have varied responses to trauma. Those of us who have had multiple traumatic exposures will have greater, up to a point, responses to our trauma. History of health and mental health, socioeconomic status, the intensity and duration of the exposure, gender, age. But the fact is, if you all witnessed a trauma, none of you would have the same response to it. Which makes this even more difficult because when you're trying to process it through, your peers aren't in the same place you are. There's very good evidence that a single debriefing not only makes people not better, but it makes them worse. Because if you bring people in immediately following a trauma, they have one perception of what the trauma is. And if you put them all around a table and you force them to share their stories about what went horribly wrong, now they incorporate the other 9 stories. So they have 10 stories of trauma. And then when they go to sleep at night, their memory crystallizes and the 10 stories of trauma become 1. That's why single debriefings are not only not helpful, but they're potentially dangerous. That's why you have to think about a process that helps people. It wraps around services to them. Because trauma manifests differently in different people. It may be depression, it may be anxiety, it may be somatization. You may have physical responses to it. Substance abuse. Any engage in antioxidant therapy to deal with your stresses? That's drinking wine at night, right? A wine glass, okay. A wine glass, not so good. How about increased family and domestic conflict? I wish I had a nickel for times that my wife has said, "Did you hear me?" No, I'm sorry. I was 20,000 miles away. Yeah. You get home at night, you try to read a book, you read the same chapter over and over, or the same page over and over, or the same paragraph over and over, and you still don't know what it said. That's particularly helpful for those of you in grad school. So, now full disclosure, I work at Harding Hospital. I have no pink slips with me. Frank, do you have any pink slips? Frank didn't bring any pink slips with him either. Okay, anybody else from Harding bring it? Okay, so we have no pink slips in the room. How many of you talk to yourself? Okay. How many of you answer yourself? Oh, come on, be honest. How many of you justify it's the only intelligent conversation you have during the day? Okay. I get it. And the idea is how you talk to yourself is very important. It's much more important than you would ever imagine. Because we were trained to think critically, we tend to question ourselves. So how many of you have asked again, what if only, I should have, if I had it to do over again? And what did you all promise me less than 10 minutes ago? You will not, do not should on yourselves. Thank you very much. But those thoughts lead to stress, anger, physical distress, feeling vulnerable, and questioning your ability. considering a career change? When we talk about stress, how many of you carry those conversations in your head to the next conversation you're going to have with somebody? And how many of you actually play through that conversation? They're going to say, then I'm going to say, and then they're going to say, and then I'm going to say, and then they're going to hit me, and I'm going to get a bazooka. And the next thing you know, we're up to preemptive thermonuclear strikes. It leaves us feeling vulnerable. It leaves us feeling uncertain in ways that is very difficult to describe. And it leads us to what are naturally occurring emotions, but also manufactured emotions. You see, I'm gonna tell us something on Dr. Hurst that psychiatrists don't like us to talk about. Do you realize that if left undisturbed, natural negative emotions dissipate on their own in 2 days to 2 weeks? They just disappear. They go away. The things we see, the things we experience, just go away. The guilt that's a normal feeling is there. If you have that third brownie and you said you're only going to have one, there's a little guilt that goes with that. It's also a little bit of reward because chocolate does a very good job at rewarding you. But there are manufactured emotions that are the natural emotions of things you experience at work combined with the I shoulds. And when you manufacture emotions of guilt and you tack on that meaning, that I should, that self-blame, the manufactured emotions are very different. You see, they assign a meaning or potential of blame, and they don't go away. They're cumulative. How many of you manufacture emotions? Sure do. We do every single day. And they can be compounded when other people contribute to that. So when something goes horribly wrong at work, guess what we do? We investigate it. And you get to go before the administrative review. And you relive it. And people ask, why did you do that? So, physical trauma. How many of you in the past month have experienced any of these physical responses to stress and trauma? How many of you have experienced one? Hands up. 2? Keep your hands up. 3, keep your hands up if you've had 3. Keep your hands up if you've had 4. Ooh, really? Keep your hands up if you've had 5. Okay. You really want to keep this around 2. Cognitive. This is my favorite. Of course, you can't remember if you forgot, but that's okay. But you'll have racing thoughts to try to figure it out, let me tell you. And the longer you do that, you'll become more irritable. How many of you have had one of these in the past few? 2 of these? 3 of these? It's always amazing to me how the number of hands go up when I tell you, you want to have less than 2, the hands come down at 2. Okay, good enough. This is your litmus test for how you're doing. Emotional. Okay. How many of you have had at least one of the emotional? You can't tell me you haven't had mood swings. All you got to do is pick up the paper. 2 of them? 3 of them? 4 of them? Yeah, the emotional ones are tough. 5 of them? You see, a litmus test. Behavioral. 1 of them? 2 of them? 3 of them? You can't tell me you all aren't obsessive compulsive. I don't believe you. I just don't believe you. How many of you don't procrastinate? Do we have any procrastinators in the room? Yeah, let me think about it, right? See how you are? You got to keep an eye on some people around here. It's pretty amazing. How many of you could feel totally alone in a room full of people? Yeah. Because sometimes our work experience isolates us. How many of you talk about things you've experienced at work at dinner? Probably not. Some of you might, but probably not, because it's not good dinner conversation. I've discovered a long time, I don't share stories from the emergency room at dinner. Not good dinner conversation. So the idea that trauma sneaks up on us and catches us is a pretty powerful situation. The immediate impact is emotional exhaustion, reduced sense of accomplishment, vertical and horizontal workplace violence, seeing the world as a far more dangerous place than you thought it might be, and in the long term, heart disease, diabetes, high blood pressure, obesity, irritable bowel, autoimmune diseases, all sneak up on us. So that's the impact of untreated vicarious trauma. So let's start thinking about resilience. So on January 22nd, I was washing a car in the driveway and looked over, I have this stone wall, and look at this flower. This thing was in bloom January 22nd of this year. Flowers are not supposed to bloom in the middle of winter, but nobody told this flower that. This little flower, everything else around it's dead. I was just amazed, but the flower was still in bloom. That to me almost becomes the definition of resilience. And what is resilience? Well, it's more of a quest and an effort. We have to seek to do it. It requires us not to take the paths of negativism and quick fixes, because there's a lot of that out there and a lot of people stay stuck in it. It requires seeking alternative responses to adversity, working against biological forces that help us to see the things that could potentially go wrong. How many of you know about Darwinian Fitness? The stuff that helps you survive. How many of you remember Walter Cannon's work of fight or flight? Right? If we're all Neander people and a saber-toothed tiger comes in that door, what are we going to do? We're going to run. Do you have to outrun everybody? Nope, just the slowest person in the room. Saber-toothed tiger comes in and there's no exit door, what are you going to do? You're going to fight. Again, do you have to fight the tiger? Nope. The most vulnerable person in the room is the only person you have to defeat. Yeah, ouch. That's human nature. It's kind of scary, isn't it? Kind of a hint as to where some of this trauma comes from. And when you come to the realization of that, you have to change the way that you think about yourself and the world. So this tree is at the bottom. We were out at Bryce Canyon last August. I try to get out and do something with nature every year. And I thought I took the 2.5-mile trail, and I ended up taking the 12-mile trail. Ouch. Which took us all the way to the bottom of Bryce Canyon. And at the very bottom of Bryce Canyon, so it's about 5 miles down, is this tree growing straight up between all of the rocks. That's a resilient tree. It's growing out of a rock, and it's growing up in between rocks. And isn't that what we do? Isn't that what we're about? Isn't that what resilience is about? This is not a path that comes natural, but I want to talk about this. This is Eric Grayton's work. Every time we make a choice to confront our fear, our character evolves and we become more courageous. Every time we make a choice to move through pain to pursue a purpose larger than ourselves, our character evolves and we become wiser. And every time we make a choice to move through suffering, our character evolves and becomes stronger. And over a time, through a process of daily choices, we find that we've built courage, strength, and wisdom. We've changed who we are and how we can be of service to people around us. And the question at the end is, what choices will you make today? Because it's easy to follow a path of resistance. It's easy to see the negatives that will threaten you. But are you good at looking for the good things? How many goods does it take to offset a bad? Any idea? Just shout it out, anyone. Are you 3, 7, 5, 10, 100? Yeah. So what I suggest doing is begin with self-awareness. Look for 3 good things at least a day. Has there been anything good here so far today? Here's a wonderful, wonderful way of starting our day with Quinita's story. What a wonderful way of putting the day in perspective. Was there coffee? Yes. Is there plenty of oxygen in the room? Yeah, we're doing well. Think about 3 good things that happened through the day and think about why these happened. What did you do that made it different? And how is being here making you a better person? And think about what went well today. And think about what you said to yourself today about how you worked through the day and who you related with. Monitor your burnout. Let me give you a tool. Emotional exhaustion. How long does it take you to recover from your day's work? Can you recharge your batteries in the amount of time that you have off? If not, you might not want to request more time off. You just might want to think about what you're doing in the time that you do have off to make it more recharging. Monitor burnout in the form of depersonalization, which is difficulty connecting with others or having cynical responses. And monitor to see if you have a good sense or a decreased sense of accomplishment, confidence, and satisfaction with the work you do. Because those are the ways that you track how you're doing. And then practice mindfulness. Now, what is mindfulness? Well, it's not actually getting down in that cross-legged kind of thing and meditating. Frankly, if I tried to do that, somebody would have to take me to the emergency room to get me untangled. So we're not going to do that, but it's self-reflective. Mindfulness thought is one that's self-reflective. It's taking a look at yourself and what you did well today. It's non-judging. What is it that happened? It's accepting. Accepting what your peers have to offer. How can you make it better? You see, one of the things is that we all compete for energy. You know, people are competing for your energy. So ask yourself, who or what is taking your energy? Ask yourself what you're doing to rebuild your energy. And what are your interactions between building and taking and losing energy? How many of you check your emails before you go to bed? Stop it. Oh, stop it. That's terrible. Because if you check your emails before you go to bed and you wake up then at 3 o'clock in the morning, what's your brain do? Turns on and starts doing your to-do list for the next day. Turn off your electronic device at least 45 minutes before you go to bed. How many of you take this thing on vacation with you? Okay. Are you crazy? Yeah. I'm self-diagnosing right now. Why do I take it on vacation with me? Because I get about 300 emails a day. And it's less stressful to log on twice a day and clean off the emails than it is to worry about them accumulating over the week's period of time. So everybody's going to have a different response, but what you do is good as long as it's good for you. How many of you watch television right up to the time you go to bed? Stop it. Stop it. Blue light is bad for your sleep cycles. Turn that off. Get away from the blue light. Notice what creates change and positive energy around here. Keep learning, a sense of humble curiosity. I realized a few years ago that I could sit and watch shows about restoring a house or buy and restore a house. I could do things like watch shows about rebuilding cars, or I could buy an old car and rebuild it. Yeah, easier said than done. I did go out and buy a car. Then I had to build a garage for the car. Then I had to buy all the tools I didn't have to fix the car. And then I realized with the garage and all the tools in the car, I had no idea how to fix the car. But you know what? I have more energy than just sitting watching shows about people. You can vicariously live through your television, or you can live. What's the best way to use my energy? Where can I take my energy? How can I contribute my energy? What can I do with my energy to make life better? Looking at other people around you that you respect and say, what are they doing that's working for them? Can I capture some of their positive traits? Can I pull those into my life? I want to be like so-and-so when I grow up. How did they get there? And can I adopt their humble curiosity? Can I adopt their positivism? How do you clear your mind of clutter and negatives? How do you share your emotions? Some of you write poetry. Some of you listen to music. Some of you get out with nature. What is it that you do that gives you energy, that clears your mind, that helps you to be one with yourself? And how much are you doing that? Or are you just racing through the tasks that are in front of you and not noticing what's important? We're really good at taking others, which means we're really, really not so good at taking care of ourselves. So part of this becomes cultivating purpose and meaning. So remembering again what brought you to this line of work and considering what is it that's driving your current mindset? What is it that's driving your levels of energies? What are your beliefs and your biases and your attitudes? And how are they changing? And what's driving them? Actually sit down and do something that you would ask your patients to do or your clients to do, to take an inventory. What's working for you? When's the last time you did any of that? What's the last time you even thought of that? When's the last time you thought of joy and happiness and awe and love and compassion? And why haven't you taken the time to think about those concepts? When you recharge your battery by finding something outside of work that makes you feel good, it helps you to build your competencies, to clarify your values, your principles, and to better understand your assets. Purpose gives you greater levels of security, understanding of significance, love, growth, and contribution to the community, to yourself. And it amplifies your levels of engagement, your pride. It amplifies honesty, and it leads you to be able to be bold and to make differences. And you can do that outside of the work setting. In fact, you should do it outside of the work setting because it adds new meaning. And that's where your recharging comes from, is doing something away from work. So now, let's talk about practicing self-care. What do you do to take care of yourself? How many of you can answer that question instantly? Show me your hands. What do you do to take care of yourself? That's only about a third of you. How many of you know what you're going to do? You're just going to be cantankerous and not raise your hands. Okay, I like that. I like that resistance. How many of you are able to take 30 to 90 minutes after your shift just to turn your brain off? I have a 50-minute drive home at night. And I realized that I can stream music through my phone into my car, and I can listen to whatever music I want. And you know what that has done? That's curtailed the amount of conversation I do to people on the highway. Because I have quite a colorful conversation with the cars around me. Now, I won't say that I experienced road rage, but I will say that I stopped chasing cars beyond my exit. That's growth. That's personal growth. The downtime can, you know, when you take off, when you turn your computer off, when you take off your ID badge, when you get in your car, when you go home, what do you do in that 30 minutes? What do you do in that 50 minutes? How do you decompress? How do you take care of you so that you leave work at work? Because when you get home, you should be there for your family. Because that's what's important. How well do you sleep? How many of you engage in naps? Do you like naps? I love naps. Naps are good things, right? Sleep less than 3 hours, sleep more than 5 hours to keep your circadian rhythm in place. Stay away from the blue light. Take naps. How many of you snack? Oh, snacks are very important. Got to have snacks, right? Healthy snacks. How many of you like chocolate? Ooh, love chocolate. I'm going to give you something very, very important here in just a little bit. Self-care continued. Avoid routines. How many of you drive exactly the same route to work every single day? Stop it. Right? What happens is your brain follows neural pathways all the time, and driving that same way becomes a routinized habit, and it gets your brain starting every single day that same routinized way. Change your path a little bit. I work at the university. They teach me to do that because I can never park in the same place because the garage is always full. So it's really, here's the dirty secret about the university. It's $1,000, they call it a parking permit. It's really a hunting permit. But you know, we could get negative about it, or it could be expanding my neuroplasticity. So I'm preferring to look at it that way. Good food at the right time in the right amount. Unplug, turn your television off, turn your device off. And how many of you are planning a vacation, please? Yes. Always, always, always be planning a vacation, because the vacation is the most important part of your day. It's hugely important. How many of you are exercising? Okay. Love to see that be 100%. Getting out, stretching, moving, getting the blood flowing. Because blood flow to the brain is very important, right? And we spend a lot of time on our brain. Right? So get that moving. How many of you get to spend time outside? Every day, 5 days. 5 days a week, every single day.
I walk 10 miles a day, every day, 5 days a week.
Nice. Get out and get that fresh air. Get out, enjoy the sunshine. How many of you spend time just enjoying, soaking in the sun? Even in the wintertime, soak in the sun. In the wintertime, summertime, all the time. Get out there, soak it in. What are you doing to take care of yourselves? That is hugely important, and a lot of us don't think about it. We don't think about it on an ongoing basis. How many of you pay attention to relationships? So, number one, the most important relationship is the relationship you have yourself. And think about what would happen if you were obsessed by the things that you did well, not the things that you didn't do well. Because we never worry about the things that we did well, do we? It's kind of silly. You never wake up in the middle of the night worrying about what you did well. See, that's that path that's different. Now, how many of you make time away from work for professional development, building new skills? Yep. How many of you are trying to do something that's not work-related that's new? Maybe learning a musical instrument or painting or something like that. It's hugely important because it opens up the new pathways in the brain. So finding ways to do music, art, poetry, anything that forces you to do something new, like building a car and a garage and buying tools, well, maybe not that. But that's my rationalization. How many of you are a mentor to somebody young? How many of you have a mentor? You know, mentors are amazing things. They give you little nuggets of knowledge that you can carry with you forever. I have been blessed to have wonderful mentors in my life, academic mentors, writing mentors, friend mentors. I had one mentor that gave me the most wonderful message that I still carry with myself today, and I came into her office with a problem, and I'll clean it up what her response was, but basically she said, Ken, that's ant poop. Come back when you have elephant poop. Mentors put things in perspective. They help you to understand where you're going and what you're doing. What are your networks of positive influence? Who do you go to? How many of you have a good friend that you could call at 3 a.m. if you needed to? You are some of the luckiest people in the world. Because if you have that support network, that's going to go a long way to keeping you well. You see, the fact of the matter is we don't think much about keeping ourselves well. And if you find yourself spending time around people that you want to be like, then it's going to happen because you will be like the people that you're around. If you find yourself having difficulty being positive, find positive people to be around, and you will become positive. Find people who find the joy in life. Find people who find the good things that they like. And understand that we all need relationships in our lives because we are certainly stronger as a group. We certainly have a better outcome when we work together. So there's something called emotional contagion out there. And emotional contagion can go in negative ways, and frequently it does go in negative ways, but it can also go in positive ways. And I would like to try here to see if I can get this to a point where you experience it. So what did you just experience? What happened to your mood? Yeah, it lightened up, it changed. Did anybody not laugh? No, it's hard not to laugh with laughing babies around, for crying out loud. Right? The idea is that emotions are contagious. And we don't think about that. So when you're in an environment and the emotions are toxic, the emotions are negative, they have a way of drawing you down. And we tend to think, well, maybe I need to buy into that so I'm accepted. Or maybe not. Maybe you can become a positive emotional contagion. Maybe what you just need to do is pull up YouTube for about 5 minutes and watch laughing babies or How many are into the stupid cat videos or dog videos or animal videos in general, right? Why? Because they raise your mood. They make you feel better. So the question becomes, what is it that you're going to do differently? What is it that you are going to do that is going to change the environment around you to make it better for you? Because what we are beginning to understand is that empathy is a feeling and a process that brings about pain. You feel as if. And what we understand is sympathy is a process or a feeling that brings about pain. How do we know this? There's a neuroscientist, Thea Singer, out of the Max Planck Institute in Germany, that brought, of all things, a cadre of Tibetan monks to a functional MRI. Why Tibetan monks? Because Tibetan monks have spent their entire lives training their brains. And they can go to an emotional state, almost at will. And so Singer asked them to experience empathy. And on a functional MRI, all the pain receptors of the brain light up. And she asked the monks to experience sympathy. And again, all of the receptor sites of pain light up in the brain. And the monk said, please, please let us experience compassion. And when they experienced compassion, all of the reward centers of the brain lit up. And the researchers said, what happened? And they said, we envisioned doing something kind for somebody else. You see, we go every single day to empathy and sympathy. And the answer, at least one of the small answers, is you can reward yourself by taking it to the next step and engaging in a simple act of kindness. And you know what? This secret is true, that it lights up all the same receptor sites in your brain as chocolate. And it has no calories. So Kim might want to think about doing little simple acts of kindness rather than giving out all that 270 pounds of chocolate. The difference is going back to what brought you to this field to begin with. The difference is recognizing that what we do is tough and difficult and challenging. But if we go back to what brought us here to begin with, and we engage in those simple acts of kindness, probably simple acts of kindness that people shared with us, it gives us energy to move forward. And it makes all of the difference in how we have energy to practice as professionals. This is much more of a process than an event, but there is good science behind this. The MRIs up above with the orange lights are the MRIs that show the pleasure or the rewards and signals in the brain. And the lower ones are the pain. So really, if I wanted to boil this down to a simple statement, the simple statement is what you've heard on an airplay 100 times before. Life lesson. Put on your oxygen mask before assisting others. And I mean seriously. We have to have gas to do what we do. It's difficult. It's challenging. It's getting more challenging. It's continuing to grow. But you can't help the person out of that depression. You can't calm their anxiety. You can't help with their obsessions about their addictions unless you've got your oxygen on. So when you leave here today, think about your coworkers, think about yourselves, and think about processes of taking care of yourself and your peers at work, and little things that you can do that translate to acts of kindness. Think about the people that you're around and how you're taking care of yourself and what adds purpose and meaning to your life. Because all of that impacts how you make a difference. The world is a better place because you do what you do. I stand in awe of the work that you do every single day. And when I look at this room of over 500 people and think of all the good that you do and all of the trauma that you're treating, it's pretty impressive. And the more that we can focus on trauma, the more we can attack the root of the challenges that we face every single day. But you can't tackle trauma until you take care of yourself. Put your oxygen mask on first, please. And with that, I'm going to shut down for questions. And there are microphones out there, so come on up and ask any questions you have. Questions, obsessions, perseverations, all of that works.
Hi, going off of what you said with the higher depression anxiety rates in individuals in caregiving fields, do you believe that it is purely due to the trauma that is experienced in the fields, or do you think that people that are already predisposed to trauma, depression, anxiety, are more compelled to go into that field?
Yeah, that is a really good question. It's kind of a $64,000 question. What I have found is that when working with people, it's never just what they experience in the field. Most people in the rules of 3s and 5s, by the end of that 5th week, are doing pretty good, unless they have other challenges that they're facing in their lives. And who doesn't? I mean, there are people who are raising children and caring for elderly, parents. There are people who have financial stressors. There are people who are going to school. And it's just, a lot of times it's that straw that breaks the camel's back. I don't know what it is about us, but I know this, is that we all in healthcare push ourselves probably farther than we should. And that's what leads others to be vulnerable. I don't think healthcare people are, for whatever reason, predisposed to be more depressed or to be more anxious. But I think we have higher expectations than the average bear.
Thank you.
Thank you.
I have one question, but I want to make a statement first. I just want to say how thankful I am to be working in a profession of helping, and that when I turn on the TV and I see what our country looks like in Washington and around the world, there are things that don't make me proud to be a human. But when I sit in this room with 400 and change of other people, it makes me proud to see that there are so many people that are committed and compassionate, and this is where I see the future of our world. And then the question I have is, what kind of car was it?
1973 Corvette. Yeah, nothing's cheap. But that's okay. It is running, and it does drive, and it is safe, which is remarkable. And, it's a great thing to do, rather than sitting at home watching TV when people do it. Great question.
You mentioned before, at the beginning of the presentation, that doing the critical stress debriefing the one time was really counterproductive and more harmful. Mm-hmm. But in considering that, is there a structured for something when an unusual incident like that occurs, and how is that implemented in the emergency department at your facility, and how might it be recommended for other facilities?
Right. So the protocol is that you don't debrief immediately. You give people time to compress, decompress, to sleep, to process their natural emotions. Then you do the debriefing. And then each debriefing has multiple follow-ups. And the debriefing involves things that you already do: psychological first aid, crisis intervention, cognitive reframing. And then you do follow-ups. You do a minimum of 3 follow-ups to get people through this process. And the follow-ups are pretty simple. We care about you. How are you doing? Here are the symptoms of trauma. Have you experienced any of these? And how can we help you with them? Follow-up number 2. How are you doing? How are things? Are they coming back to normal? You know, you are singly the most important asset this organization has. What can we do to support you? And the third follow-up is that how is it that you're doing? Are the things that you're getting enough to help you through this? And how can we continue to help you in the long run? Are there system issues that we can look at? Are there other things that we can look at? All the while, you're doing crisis intervention, cognitive reframing, you're doing problem solving, and you're bringing the individual into the organization, and you're processing through fears like returning to work. What will my peers think about what happened? Squelching the rumors. Rumors travel very quickly after significant events. How does that person reintegrate into the community? How do they reintegrate into the workforce? What do we do to protect them through all of these processes? And that's the follow-up, because if we are worth our salt in the work that we do, we protect the single most powerful and important investment we have, and that's our staff. And I will tell you this, so you have to sell these programs at an organization like the Ohio State University, right? So here's how we sell this at the Ohio State University. If you lose a nurse, it's going to cost you between $75,000 and $125,000 to replace that nurse, and you're going to lose the productivity of that nurse during that period of time. If we lose even 3% of our nursing population a year because they believe the organization up the street or down the street will take better care of them, that's $3.2 million a year. Because we have a lot of nurses at that hospital, right? You do the same thing for every staff. Think about what it costs to replace somebody at your organization. This is a really cost-effective return on investment. So that's why we do that. Yes, sir.
First, I just want to thank you for being here and sharing. I could listen to you all day.
Thank you.
I've got an answer that you probably haven't heard before when you were asking people why they got into the field.
Mm-hmm.
I got into the field to understand myself better.
Wow.
I am my only patient. And I've learned so much.
Yes.
Because of people like you. Thank you.
Thank you so much. Yes.
I just want to know, how do you like self-care when you see clients like trauma, homeless? It becomes like a norm. So how do you because you want to rush and help everybody, so how do you protect yourself from seeing that as a norm and just jumping in trying to help clients when you know it's kind of like unsafe, but you really want to help them and you don't think it's unsafe? You're just like, I got to help my client. And so how do you do that when it's become like the norm for you every day?
Right. So it's like Robin Williams said, the problem with life is there's no scary music to warn you that something bad is about to happen.
Uh-huh.
Yeah, and we run into that a lot. So sometimes you have to slow down to keep up. Sometimes you have to think about the actions you're going to take. And all of the time, you have to keep in mind, what do I need to do to take care of myself? So Friday afternoons, usually around 2:30, 3 o'clock, I'm leaving my office and everybody says, oh, you're starting your weekend early. The answer is no, I'm going to my therapist.
Okay.
Because this is what I do every day, all day, and I'm running from crisis to crisis to crisis. And you know what? If you don't find a way to offload into balance, you are absolutely correct. That becomes everything in the world that you see.
Okay.
I also understand that working in a hospital setting, I need to be around healthy 80-year-olds. And I need to see healthy 80-year-olds dancing and listening to music and having a good time. Because you work in a hospital, you begin to think everybody who is 80 is not doing well. So I need to find those kind of balances. And probably a lot like you, I need to surround myself with people that help me to understand when I'm going a little too far. Because my barometer for that really stinks.
Thank you.
Thank you. I think they're hungry.
I think so too. Last question from anybody?
Sure.
Sure. Yes, we'll post it on the OMAS website and OACA website. And we'll get that address and we'll project them up on the screen at the end of the day. Can we thank Dr. Yeager one more time, please?
Thank you. Thank you. Don't worry about that. You don't have to.